Hi, I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and today we're going to talk about the steps of functional blood chemistry evaluation in order. So, what I found out when I started studying functional blood chemistry, functional medicine, there wasn't a real good hierarchy or an order in which you should check things out. And so I looked at the way the body functions, and I said, well, there actually is kind of an order. So I'm going to go over this with you right now. This is very, very important, extremely important. People will say to me, well, how are my adrenals doing? That's down here on number 12, okay? All this other stuff above it needs to be taken care of first. If you don't take care of things from the top down, you will not get better, okay? By the way, notice cardiovascular markers all the way at the bottom. Not that they're the least important, they're the last thing to be handled, because when you handle these, that gets better. Pretty cool, right? So these are the markers that we deal with. The first one is blood sugar. Blood sugar is the most common thing that's off in our country. Also, blood sugar is part and parcel of preventable problems that we have in our country. 80% of chronic health problems, blood sugar is a big problem with it. By the way, if you're saying, a lot of doctors will say your blood sugar is fine because your fasting blood sugar is okay, that's only one of the 3 tests that we absolutely always order on our functional blood chemistry analysis. The other ones being fasting insulin, which I've never seen a medical doctor order, and an HA1C, hemoglobin A1C. All 3 of those have to be ordered, okay? So blood sugar is number 1. Number 2 is dehydration. Why is dehydration number 2? Because it's really freaking easy to fix. You drink water. Also, it's really easy to see. It messes around with your red blood cells and your protein concentrations in your blood. And also, if you do not fix dehydration, you do not get better. You literally will not detoxify properly. Conversely, if you don't fix blood sugar, you won't fix digestive, hormonal, or immune system problems. Okay? So that's why blood sugar is number 1, dehydration is number 2. Number 3 is iron overload. Iron overload is present in about 1 in 10 or 1 in 20 people. Most people never heard about it. I learned about it from one of my mentors, Chris Kresser. If you're watching this, Chris, hi. Guy's great. He talked a lot about iron overload. Saved my life, my wife's life. About 1 in 10 to 1 in 20 people. Genetically, I think the statistic is 1 in 9. Although just because you have genetics doesn't mean it's expressed. But 1 in 9 people have it. But 1 in 10 to 1 in 20 people are actually showing it when you check their blood chemistry. But if you have too much iron in your system, it causes a lot of inflammation. If you do not take care of it, you will not get better from blood sugar issues, inflammatory issues, immune system issues, anxiety, depression, and pain. My wife had chronic pain, anxiety, depression, and she would just all of a sudden like run out of energy, and she was always sick. We found out she had too much iron, and you know what the treatment of choice was for her? She gives blood once every 2 months. So she's actually helping somebody else, okay, and helping herself. By the way, she didn't have sky high levels. That's called hemochromatosis. That is really deadly. She just had levels that were causing inflammation. Not dangerous to somebody else when she gives blood, just not good for her. The next one is iron deficiency. Why is iron deficiency so important? Well, one in 3 people in the world excuse me, is iron deficient. And one of the common symptoms of iron deficiency can be anemia, although sometimes it doesn't get that bad. But it'll also mess with your metabolic machinery, okay? And so, to put it bluntly and shortly, you run out of energy. You're not going to get enough oxygen to your tissues. If you don't get oxygen to your tissues, try holding your breath for about 30 seconds, only breathing maybe 5 times per minute. You will get really tired and feel like garbage. You'll start to ache. Same thing happens with iron deficiency because you're not getting enough oxygen to the tissues. That's why and it's a really easy fix. We have something called Ferrofood downstairs. You give them usually, depending on how bad it is, 3 to 9 of those, they get better. Vitamin D, by now, unless you've been sleeping under a rock or living under a rock, you'll know that vitamin D is deficient in, when I check people over the winter, where we live in Lancaster, Pennsylvania, I have not seen a single person that did not supplement that had adequate levels. Okay, everybody, and I mean everybody, 100% of people were deficient. Okay, when does the cold and flu season happen? Okay, and the COVID season seemed to be over the winter. All right. Vitamin D deficiency played a big part in all these things. All you got to do is look at online references for that. Okay. Very easy to assess. Magnesium. This is also another rampant deficiency. Vitamin D helps your immune system. It also helps to balance your blood sugar. Magnesium, okay, when you're deficient in that, it can alter your blood sugar. It gives you a lot of anxiety, insomnia, chronic constipation, pain, all these types of things. It's very, very easy to fix. I think it's like 40 to 50% of the population is actually deficient as well. And so that's why we put it number 6. A lot of these things, blood sugar, the thing is you won't get better unless you fix this. You won't get better unless you fix this. These things, what happens is they're just very easy to fix. And if you fix these, it helps what's below them. That's why I put them a little bit higher. The next one is zinc. Once again, living under a rock, you haven't heard of zinc. If you have not been living under a rock, you've heard that zinc really helps your immune system. It is very, very deficient in people. There are certain blood markers that show when it's deficient, and we can actually reinforce that. There's actually a taste test for it. Okay, if you show that you're deficient on your taste test and your blood markers, we give zinc. It works very, very well. You'll see people with zinc deficiencies. First of all, everybody knows that it weakens your immune system, but in men, it can cause enlarged prostate. Yep, seen lots of people with enlarged prostate, back pain from zinc deficiencies. What else can it cause? It can have a problem. If you have a zinc deficiency, you're more prone to iron overload. And there's other things to do with it. Mainly what we look at is immune system function and prostate health in men. Okay. The next is B1. Yes, B1 deficiency is actually very, very common. And people with B1 deficiencies tend to have a lot of anxiety, depression, blood sugar problems. And you can find that very easily on blood testing. Also B9 and B12. Deficiencies of these, the big one is going to be nerve problems, okay? Anxiety, depression, and nerve problems. And so you can find that very easily on functional blood chemistry, and you just get B9 and B12. Immune system. The one thing I would say is that I put immune system down here because most people that come in, they don't come in because they have an acute immune system problem. They come in because they're like, do I have Lyme disease? Do I have chronic fatigue? Those are what's called chronic immune system disorders. And so we put them at number 11. If you don't fix number 1 through 10, or 10 through 1, you will not get better from 11. That being said, let's say someone has some kind of acute infection, you would put that actually over here behind number 1. Why would you put it behind number 1? Because if you don't fix an acute immune system dysfunction, often it will lead to dehydration, iron overload or deficiency, and all these vitamins and mineral deficiencies. That's why we put it number 2 when it's acute. But right now, we treat it as number 11, okay? And we do that because if you don't treat an immune system disorder, okay, a chronic one, it will lead to adrenal dysfunctions, liver and gallbladder dysfunction. I've had a number of people come in with liver and gallbladder problems that actually had an infection, chronic infection. A lot of people with adrenal stress from chronic infections. A lot of people with thyroid and inflammation and cardiovascular disorders that are coming from the immune system. So that's why we put the immune system at number 11. Number 12, people always like to look at adrenal dysfunction. That was a big buzzword a couple years ago, adrenal fatigue. And they like to treat adrenal fatigue. But actually, you treat 1 through 11 first. Because if you don't handle the big one being blood sugar, what happens is your blood sugar goes up and down. Every time it goes down, your body secretes adrenal stress hormones, and you'll just wipe out your adrenals. Okay? Or if your blood sugar is too low, you'll release a lot of adrenal stress hormones. Okay? Liver and gallbladder is number 13. The reason why, once again, especially with blood sugar, if the most toxic thing right now that's causing the most damage to livers, not the most, I shouldn't say the most toxic thing, but the thing that most people are exposed to that's causing damage to the liver is actually sugar. And so that's why we treat that first and why liver's all the way down here. Next is kidney and bladder, then inflammation. Yes, inflammation is all the way down here. The reason why most people have inflammation is from blood sugar disorders, iron overload or iron deficiency, vitamin D deficiency, digestion and absorption problems, and immune system disorders. Okay? That's the reason why we get a lot of inflammation. Okay? And then a lot of people have thyroid problems too. Once again, the reason why people have thyroid disorders is from blood sugar problems, usually. If you don't fix iron overload or iron deficiency, thyroid never gets better, by the way, and it's present in almost all cases, either too much or too little. Vitamin D, if you have too little, thyroid won't heal. What else? If you don't digest properly, your thyroid won't work. If your immune system, usually people with chronic thyroid problems have some kind of immune system challenge, especially viral. Okay? And then we get to cardiovascular. Cardiovascular problems, the majority of them in this country are actually caused by blood sugar problems. Notice how many times I mentioned blood sugar. That's why it's number one. But you'll see, like I had a person come in with recently who seemed like he was doing fine. I have old blood work from him. And all of a sudden he's got all these elevated cardiovascular markers. It was coming from blood sugar, iron overload, vitamin D deficiency, magnesium can cause it too, B vitamins, digestive problems, and immune system dysfunction. That's the reason why cardiovascular markers are number 17. So my message is this. If you're going to treat yourself with functional blood chemistry, if you're under the care of another doctor, that's cool. Make sure that they're taking care of all these. And if they say, if you're looking to see whether you have adrenal dysfunction, and they say you do, ask them if they're treating all these. If they say you've got a thyroid disorder, ask them if they're treating 1 through 15. Make sure that you handle them in order. Okay? Thanks.